I'm a primary care doc, and I am seeing a ton of upper respiratory infections right now. One question I get a lot is, can exercise cause me to get sick? And second question, is there any role for exercise in recovery? Specifically, when can I start running again? Because I feel like garbage today. Well, let's talk details. First thing to know or to talk about is make some definitions. What are we talking about with upper respiratory infection? So, upper respiratory infections are any kind of infection that occurs above the lung in the linings of your airways. So, that'd be like your trachea, your throat, mouth, nose, sinuses. Uh, those areas are lined by tissue called mucosa, which is kind of like the gooey covered spaces of the body where your body traps pathogens as they're trying to get down into your lungs and prevents them from getting there in the first place. So there's two kinds of infections that are worth talking about anyway. First would be viral, second would be bacterial. In general, for the purposes of this discussion, we're talking about viral infections, which make up about 80 to 90% of all upper respiratory infections. And things that would stand out to you as typical viral infection: low-grade fever, meaning 102 or less. Symptoms are usually more mild, and the symptoms tend to last longer, like 10 days, sometimes even 2 weeks. Common bugs that we would call viruses would be influenza, RSV, COVID. Funny thing is that before COVID was COVID, it was coronavirus, which is the common cold. And then some other lesser known names, something called the rhinovirus, things of that nature. There's about a bajillion of them, and that's why we just keep getting sick every year, because they mutate, and there's about 100 different strains that can all cause more or less the same type of symptoms. Again, runny nose, cough, sore throat, low-grade fevers. Now, again, for the purposes of this talk, we're really mostly focused on that. And back to that original question, can exercising cause a infection? Well, strictly speaking, no, because viruses cause viral infections. But something that exercise can do is alter your immune system and its ability to fight an infection. And so studies would suggest that immediately following high intensity exercise or extreme long duration exercise for you, so if you don't run for an hour ever, and then you decide to run for an hour on a given weekend because you really want to get back into it, that would be long for you. And so when you put that large load on the body, it can cause reduced immune cell function. Typically, that's on the order of a few hours, not days or weeks. But the current running theory about that is that you create a window of opportunity. Essentially, you knock out the ability of your first line of defense immune system, and so that a virus can sneak in at that right moment if you're exposed at that right moment, and then that virus then causes an infection. This is important because, almost went down. This is important because if you are planning an exercise event, say right before a big race, or you're planning to travel somewhere and you don't want to be sick, you should probably be careful that you're at an opportune time to be sick. One study showed that marathon runners were much more likely than the average person or the average runner actually to be sick in the peak training period right before the race, and then for about a week or so following the race. And again, that's probably following the theory that during those times, those runners were exercising way harder than they normally would, and so their immune system took a little bit of a hit. Important thing to know too, there's tons of confounding factors. If you have chronic medical conditions, if you're not physically fit, if you have an eating disorder, or if you're just really not nutritionally keeping up with the demands of running, those can also significantly increase your risk for developing an upper respiratory infection. What about the good news? Well, the good news is that studies would suggest regular physical activity in general reduces your risk for serious infection and serious illness, which kind of makes sense, right? If you're healthy, you're taking care of your body, then of course your immune system is going to work well. Interestingly enough, certain other studies have found that it can decrease immune cell aging. What does that mean? Well, immune cells tend to not work as well as you get older. And so when someone is regularly exercising, we have found that those immune cells function more efficiently, like when you were young. And so, again, reducing your risk for infections later on. We know this from pretty extensive research that people over the age of 65 are significantly increased risk for bacterial pneumonia, which is different than viral, a lot more deadly, and that's a big and important thing to be paying attention to when you're older. Okay, so we talked about why exercise is important, what it could do bad, what it could do good in the short and long term. How do you structure your exercise so as not to get yourself in a pickle and get sick all the time? Many runners will comment that they are constantly dealing with upper respiratory infections. Why does that happen? Well, generally, that's because of overtraining. It's a well-known phenomenon amongst runners, and it really hits on exactly what we just talked about. So if the average runner is running, we'll say, pretty close to all out on a midweek short distance training run, they're probably exercising at or above threshold for a large amount of their training. What is threshold? Threshold's essentially, for most people, 60% of their maximum physical capacity in a run. So let's say the fastest mile you could run is a 6-minute mile. We're talking about like maybe that person running a 7-minute mile or greater, or lesser. So if you find that on your average midweek run, the majority of the time you're running so hard that you couldn't be having a conversation with me right now without having to stop to catch your breath, odds are you're pushing it really hard. And again, if that's the majority of your runs, you're probably tanking your immune system after each run. Now, once or twice a week, that might be okay. But again, 4, 5 times, 6 times a week, that is not a good situation for your body in general, but specifically your immune system. And it's a common cause why an average runner might be getting sick every month during training, because they're just constantly exposed. They have no defenses. Their immune system is not doing so hot. A great example of this is myself. I was a medical resident not very long ago. That's doctor in training. During those times, we had to work really long hours, like 80, sometimes over 80 hours a week. and little sleep, not a whole lot of time for exercise, but I was really invested in running at the time, and my motto was actually run more, sleep less. And I was clearly exercising at the wrong intensity, the wrong amount, not giving my body rest, nutrition, all of these things. And so one day I put in the best run, but actually run to work. And I did 8 miles at my best pace, super stoked. The following day, I ended up in the hospital with influenza pneumonia, coughing up blood, and had to spend a few nights there. So I had clearly tanked my immune system and left myself vulnerable to all the worst that influenza could do to me. Ironically, that was actually January 2020, right before COVID was a thing. So that's you getting sick, but let's talk about recovery. One interesting note is that there is actually some supplements that have been found to be somewhat helpful to fix this conundrum. Specifically, phenoloids. Basically, suffice it to say, some interesting nutrients predominantly found in fruit. Things like bananas have been found to be helpful. And there's actually a lot of beneficial supplements that have been found, or molecules that have been found within fruit. Another one that comes to mind is quercetin, which has been shown to increase muscular endurance. Again, eat lots of fruits, eat lots of vegetables. It's going to do a big job for you. But okay, let's say you forgot to take your quercetin, you forgot to eat your fruits and your veggies, like your grandma always said that you should, and you are now sick. Do you exercise while you're sick? So there's a lot of conflicting kind of layman's approach to that. Very, very limited research, so understand that I am speaking from opinion in the most part, but the general consensus is if you're acutely ill, as in typically the first 3 days of the illness, you probably shouldn't exercise. Sleep, nutrition, those are likely to be your best friends for recovery. That doesn't mean you're going to be better the next day, but you're probably setting yourself up for success over the next week, 2 weeks, 3 weeks, months even. What do I mean by that? Well, the average viral infection lasts between 5 and 10 days. And typically, the worst of it is the first 2 or 3 days. Not uncommon for an influenza patient to have fevers, chills, body aches, really feel terrible that first 3 days. And then your fever curve, as we call it, comes down after that, even though you still do have some symptoms. So rest assured, if you have a fever, exercising is a bad idea. You're definitely not doing yourself any favors to get fitter or certainly get better. However, what happens after that? When can you start to run again? Well, typically viruses in circulation in your body actively infecting cells in that first, again, 5 to 10 days. We studied this pretty extensively with COVID, and people are not shedding virus generally after day 8. And so I would say after day 8, if you want to be really safe after day 10, it might be okay to consider some kind of exercise. But that exercise really shouldn't be setting you up for failure, like we already talked about. If you're going to do high intensity exercise, you're likely going to harm your immune system and you're not going to be helping your recovery very much. But if you engage in low intensity, low aerobic activity, that's probably very helpful. There's actually tons of data from hospitalized patients who had pneumonia and from those who actually weren't infected at all, that if they were sedentary and not asked to breathe deeply, they are at a very high risk for poor recovery and the development of subsequent infections to include specifically pneumonia. And that's because when you're not expanding your airways and you take shallow breaths, you allow mucus that's settled down in the deep parts of your lungs to block air passages off completely, and they collapse in that interim, at least temporarily. Something we call atelectasis. You can actually see it on an x-ray where the bottom part of someone's lung will be kind of whited out, almost looking like pneumonia, except it's on both sides. And generally speaking, we're looking at it at patients who don't have symptoms of pneumonia. And that's how we can tell that's what it is. But all that to emphasize that closing off your airways, not good. Sets you up for failure later on. And so light activity kind of forces you to take deep breath, fully expand those lungs. Also, we know that there's many beneficial effects of exercise on mood, which in turn improves your holistic health. We know that exercise improves circulation, gets your heart moving a little bit. So what should that look like? Well, if you're a runner and you're very physically fit, that would be an extremely low intensity, like, let's say that you average train at an 8:30 pace. You should probably drop that to a 10-minute pace. And if your average run is 5 miles, you should drop that to like 2. Now, you're gonna have to watch your own body, be able to tell, hey, this is too much or this is too little. For those of you who aren't runners, go low. Think, what do I want to do? And then probably cut it in half for the first day that you want to get back into activity. Wake up the next day, see how you feel. If you're worse, odds are that was too much. If you're more or less the same or a little bit better than the day before, then you probably didn't push it too hard. And taking a day off and repeating it the following day is a reasonable choice. Now, some of you may be remembering a time during COVID, very early on in the pandemic, where the official recommendation was to not exercise for 2 weeks after your infection had resolved. And that was because athletes were dropping dead, and they thought this is got to be some crazy kind of post-COVID inflammation, something. I was at the time in the active duty service, and so that was particularly important. We had to tell active duty members, you cannot do PT for 2 weeks because we're worried you might have some kind of fatal heart arrhythmia. In general, that's borne out to not actually be necessary, and there's not really great data around that recommendation. But I would say that I still suggest that 2-week time frame, not engaging in any high intensity work, is going to be a critical move, just to make sure that you don't overdo it. Particularly if you had COVID, there's a phenomenon called post-exertional malaise. Now, that's pretty much specific to COVID, but there are some who have had symptoms similar to this from other viral infections. And basically, what happens is you got better, but then you pushed it just a little, not as much as you normally would, and then afterwards you feel like you have COVID all over again. Headache, body aches, nausea, sensation of chills. And if you're recovering from COVID, that means that you definitely pushed it too far. The big lesson, although not research-based right now because there's just not been enough time for us to study long COVID people, but the big foot stomp has been graded return to activity. So what does that mean? Well, that means, again, let's say you were running 20 miles a week. You got to dial that back to like 1 mile runs 3 times a week. And then at the end of that week, assess how it went. If you didn't have any of that post-exertional malaise, okay, you can maybe crank it up about 10% for that week. And very, very, very slowly. Because if you overdo it, you're gonna end up delaying your recovery, making that bigger challenge. So again, summarizing what we talked about, exercise can lead to frequent upper respiratory infections when you're doing it too hard for too long. Essentially loading your body with more exercise than it knows what to do with. But over the long term, particularly lower intensity exercise is going to be beneficial to your immune system to prevent illness. When you get into recovery, exercise is okay after the initial infection is resolved, and it should be done in a graded fashion, slowly returning to where you were previously. Paying attention to your body, of course. And then fun facts, there are actually some benefits to fruits and veggies, and one of them is improved recovery and improved immune function in athletes who are churning and burning all the time. So until next time, we'll go on a run maybe next week.